My name is Dr. David Dyer. I'm a naturopathic doctor. I've been practicing for approximately 30 years. And in 2008, I actually became a certified cancer coach, and I've worked with quite a few cancer patients in helping them overcome the side effects of drugs, if they choose that way. But most of the people that seek me out are looking to not use conventional therapies and find other ways to help overcome their disease.
All right, and you find yourself in Tijuana, Dr. David, and what are you doing here?
Well, I'm actually being treated for cancer.
Okay, all right.
Of all things.
Okay.
But I was diagnosed in May of this year, and at first, because of the knowledge that I do have, I attempted to do this on my own, but this is not a do-it-yourself home project. I found the cancer was accelerating faster than I could offset it, even with my therapies. And so I decided that I wanted to get a leg up and get ahead of the disease. And I found this clinic, which I'm very, very happy that I did. I'm in my, today's my last day. I'm going home after today. I've been here for 36 treatment days. Okay. And the improvement that I have seen here is absolutely phenomenal. I don't know exactly how to express it in words, but had I gone conventionally in the United States, I would be sitting here talking to you right now.
I understand, and a lot of other folks would not, and neither would Peggy Sue, and it's our pleasure to tell our story, and now you're telling your story.
Absolutely.
And so those pancreatic cancer patients that's going to find your story is going to find success.
Right.
Is there any, if you could tell them in one or two sentences, folks that are viewing this, what advice would you give them, Dr. David?
Advice I would give them is don't wait too long, and the least amount of conventional therapies that you do will have less of an impact on the natural therapies here. Now, I came here with no conventional treatments whatsoever. My body began to respond right away, and I'm very happy that things came out the way that they did. Don't wait too long, because you'll get too weak, and try not to do conventional therapies.
And just one or two other questions for you, Dr. David. Some folks have questions about safety in Tijuana and Mexico. And could you tell us real shortly about your experiences, if any?
Sure, sure. Tijuana is a metropolitan city. I mean, it's not something that you worry about going out on the streets at all. It's perfectly safe. A lot of times when I talk to people about Mexico, they envision in their heads a shack somewhere with dirt floors and an old dog laying out front. That's not this at all. The staff here is highly professionally trained.
And you are staying in which housing hotel?
Actually, my wife and I came here in an RV, so I'm fortunate enough that I'm actually staying in Chula Vista, so I cross the border back and forth morning and evening. But they have plenty of lodging here. The Lucerna Hotel is where I started staying when I first got here. Beautiful hotel, all the amenities that you could imagine. Service is top-notch.
Tell us about crossing the border every day. How do you feel about that?
Well, I have no problem with it whatsoever. Coming into Mexico is very simple. Very, very simple. I just walk across the border. Going back, you have to go through the border patrol and so on and so forth. And it takes a little bit of time, but they have a disabled line. And I'm temporarily disabled because I'm being treated for cancer.
Right.
So I get in the disabled line, and I usually cross the border within 15 minutes.
Well, that is great.
Yeah.
All right. Well, it has been our pleasure to speak with you today, Dr. David. God bless you and continue to do well.
Thank you, Jim, and God bless you, and you continue to do well.
Take care.